Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Brett Oliver, who's the Chief Medical Information Officer at Baptist Health. Did I get all that right?
Yes, sir. Correct.
All right. Now, one of the things you've been dealing with is telehealth, and we're going to talk about some technology that will help telehealth. But tell me a little bit about telehealth, how we got, COVID really kind of brought it to the forefront, and tell us a little bit about that.
Sure, absolutely. So I would just simply define telehealth as the delivery of healthcare by some kind of digital means. So video, audio, even email could be considered telehealth. But for our discussion, I think most people talk about video visits. And so, where someone's at home, has a camera, a doctor's taking care of them remotely from their home or their office. And so at Baptist, you're right, I think COVID was a sentinel moment where we were using some video visits prior to COVID, primarily in behavioral health and a little bit of urgent care. But we went from that overnight to literally training all of our medical group providers, 1,300 plus folks, how to do video visits. And while that was important from a cultural standpoint, from a taking care of the emergency of COVID standpoint, it was a real cultural moment for us too, because there was some resistance from our colleagues to say, I don't think that you can do visits that way, and it's not right, it's not good quality. And when you were forced to, it was a huge sort of pilot of sorts, realize, hey, wait a minute, I think this could work in certain circumstances.
And we've been doing that and getting a little better at it, and it's become more of the mainstream than not. But now there's what it's called TIDO Care,
Correct.
which is a new instrument. You brought some with you there.
Sure did.
Tell us about that, what it is, what it does, and how it helps.
Absolutely. So one of the things that you find out when you do a bunch of video visits is, I can observe you, I can figure out some physical exam things just, by a screen, but parts of the physical exam, there's a gap. I can't listen to your heart and lungs, I can't look in your ear. And so this TIDO device bridges that gap somewhat. So this is just an innovative device. This particular one, attachment here, it's got several attachments, is for heart and lung sounds. But I can listen to your heart and lungs virtually. I can look in your ear, look in your eyes, take a picture of your skin, take your temperature, all done remotely. And so that expands that capability of a really high quality video visit when you can add in the physical exam piece.
Expands it greatly because it just went from visual to now you can actually examine the patient. Now, I've talked to you before, I still think that probably laying your hands on the patient is always the best. But the reality is, from a convenience standpoint, from an infection standpoint, maybe we are going to move a little bit towards telehealth. But tell me what kind of visits might be good for telehealth? Because not everything is, I'm assuming, or maybe it is.
No, I agree with you. And I think, we always make the point, my digital team and I, most of these things are not done by digital. Most of our visits that we take care of. But lots of things can. Very simple acute problems. We use it a lot in our virtual urgent care. So we have 24/7 providers that, I'll tell you, one really, really common scenario is with families, with young children. You get home from work, one of the kids has an earache, and you're like, oh great, here we go. The whole evening is going to be shot. I've got to pile everybody in the car. It's usually going to involve an unfamiliar urgent care or emergency department. No, stay home, use the TIDO device and get a high quality visit for that earache. We're utilizing in some school systems, being able to provide an on-site clinic, but not the costly, on-site person, where you can have a nurse practitioner or physician cover multiple schools at one time. And then overflow in an urgent care. So urgent cares are notoriously difficult to schedule because people walk in. We found a real big use case for that. You come in with your sore throat or your earache, and unfortunately there's an hour and a half wait. Or if you want to come over and sit at this kiosk, we've got someone that's off-site that can do that virtually, within minutes. And so that's been a real popular use of that.
And with TIDO, you can actually look at the ear, look at the throat. But how do you access TIDO? Tell me a little bit about that.
So to access it, you can go to our website at Baptist Health to purchase one. Believe it or not, Best Buy carries them. They're getting into the healthcare business and they carry them. It's $149. You can utilize your HSA or FSA accounts, to purchase them. But it's a real simple sign-on. It tells you exactly how to do it. This little screen here will show you where to place the device when you're listening to heart and lung sounds. And so we're excited to expand use. All kinds of use cases come to mind. And I think you bring up a good point, though. It's not pertinent for everything. And so, for instance, a surgeon needs to lay their hands on you to determine if you have appendicitis. But could the surgeon look at that wound a week later for a post-op visit when you're driving an hour and a half, say, from Eastern Kentucky? I think that might be appropriate. So it's getting my colleagues to think a little bit differently on how we can hybridize care delivery.
And it's going to be a little bit of a change for both patients and physicians, but it sounds like it's really a good step in the right direction.
It's been fun. It's been really exciting, the convenience for patients and, for the providers. As you and I know, to look at an eardrum, it's about half the size of a pencil eraser versus blowing that up on my computer monitor. It's the size of a cantaloupe to look at that eardrum. The quality is really great there.
Well, we appreciate what you do. We appreciate you coming in and talking about it.
Thanks. It was a pleasure.
Entitled care might be a good thing for you in telehealth. We'll be right back.